Epilepsy is a chronic neurological disorder. It is one of the commonest paroxysmal neurological disorders which is seen at any age. So far as epilepsy is concerned, it is more common in pediatric population, usually under the age of 20 years. But in recent past, it has been seen that the incidence of epilepsy has increased in elderly above the age of 50. The causes of epilepsy in children are different as compared to middle age and elderly. Now, question arises, what is the difference between epilepsy and seizure? Before we go to this question, we should know what is seizure. Seizure or epilepsy results from abnormal excessive discharge from cerebral cortical neurons. And most of these neurons are overexcited to release more and more these impulses, which gives rise to seizure activity. Now, seizure activity can manifest as altered sensorium, like patient can have drowsiness, patient can go into coma, or patient can have transient loss of consciousness, or he can have a blank spell. When seizure is associated with motor manifestations, by motor manifestations I mean patient gets tonic-clonic movements of the limbs, patient gets this frothing, patient gets uprolling of the eyeballs, and patient gets incontinence of urine or stool. That time it is called convulsion. And if you have two or more than two episodes of this convulsions, that time we label a patient to have epilepsy. Coming to the diagnosis of the epilepsy, epilepsy is primarily diagnosed from the history given by the attendant or an eyewitness. Number one. Number two, we can corroborate diagnosis by taking an electroencephalography, which records electrical activity of the brain. And most of times we can get abnormal discharge on the EEG. And after that, we go for neuroimaging. In neuroimaging, we can go for CT scan of this brain as well as MRI of brain to find any cause responsible for epilepsy. If a patient is diagnosed to have epilepsy, he has to follow instructions from the treating doctor, because epilepsy is not curable, it is controllable, and patient has to take medications for a long time. In around 70 to 80% cases, we stop medication after 2 to 3 years if the seizures are adequately controlled, and this decision is taken by the treating neurologist. However, in another group of 20 to 30% cases, epilepsy can recur. These patients we call as refractory epilepsy. They may need treatment indefinitely, maybe for several years, it may be lifelong. Depends upon the type of epilepsy they are suffering from. If a patient gets a fit or convulsion at home, the caregiver has to be given some instruction. Number one, patient should be, the clothing of the patient, especially around the neck, they should be untied. Number one, we should not put anything in the mouth during a convulsion or during a fit. The attendant should not put a spoon in the mouth, or we should not put water or something once patient is having fit. Once patient fully recovers, he becomes fully conscious, that time you should feed him. Till then you should not give anything orally if patient is throwing a fit. If patient throws a single fit, he is likely to have this recover his consciousness within a few minutes. If patient has repeated fits that we call status epilepticus, he should be taken to nearby health facility where he can be managed as per protocol.